years ago, one of my favorite shows was White Collar, which followed a con man named Neil Caffrey and his reform process by working with the FBI. And one of the things that stood out to me was that even throughout his reform process, he was relying on the skills that he had developed as a con man to help the FBI solve crime. And I realized that there's a moment in every con that professionals in law enforcement, they call the handshake. It's a moment when the mark believes the deal is done. They start to relax. They stop asking questions. They put away the suspicion that something isn't right, and they accept that they got what they came for. The handshake is the whole game, because once the mark believes it's over, the con artist is already working the exit. I'm going to talk to you today about a handshake, a very public one that was announced from the White House, covered by every major news outlet in the country, and celebrated as a historic victory for the American patient. And then I'm going to tell you about what 16 of America's largest pharmaceutical companies quietly told their shareholders in legal documents, in SEC filings, in the fine print that almost nobody reads, about what that handshake actually meant. Because they're two very different stories. And you deserve to know both. Welcome back to Bust Big Pharma. I'm Rob Burgess, and today we're going to talk about something that has happened in two acts. Act 1 was very visible. It happened in press conferences and briefing rooms and cable news chyrons. It was announced with confidence, and it was received as a genuine breakthrough. And by any honest measure, it was the result of real political will and real presidential pressure, the kind of pressure this industry has not felt in a very, very long time, if ever. Act 2 was much quieter. It happened in the dense regulatory filings that public companies are required to submit to the Securities and Exchange Commission, the kind of documents that financial analysts read and almost nobody else does, the kind of documents where companies are legally obligated to tell the truth to their shareholders, to the market, to investors who need accurate information to make financial decisions. The gap between those two acts is what this episode is all about. So here's your background. President Donald Trump made pharmaceutical pricing reform a central commitment of his second term. He directed his administration to pursue what is called Most Favored Nation Agreements, MFN deals, with the pharmaceutical industry. The concept is straightforward and frankly, very, very long overdue. The United States pays dramatically more for prescription drugs than any other developed nation. Americans pay, in many cases, 3 times what patients in Germany, France, Canada, or Japan pay for the exact same medication made by the exact same companies, often on the exact same manufacturing lines. The president's position was simple. That needs to end. American patients should not subsidize the rest of the world's drug costs. The United States should pay no more than the most favored nation price, the best price any comparable country gets. And that's the right position. It's an America First position. It's a position that this show has supported from the beginning. The administration pursued it. They negotiated, they applied pressure, and in the spring of 2025, they announced that 16 of America's largest pharmaceutical companies had reached agreements. 16 companies. Historic. Frankly, unprecedented. The president declared it a win for American patients. And it should have been. But then the SEC filings came out. Let me be precise about what the administration announced, because precision matters and because the intent behind these agreements is genuinely important. The Most Favored Nation agreements required participating companies to do several things. They would provide some products at discounted prices for cash-paying customers through a program called Trump Rx. They would sell existing medicines to Medicaid at prices available in peer countries. And they would set U.S. launch prices for new drugs at parity with those reference countries. And if the administration successfully pushed other countries to pay more for American drugs, raising international prices, the companies would return a portion of that increase back to the United States. In exchange, companies would avoid pharmaceutical tariffs for 3 years. Now, that is a meaningful set of commitments. If honored, if implemented, if durable, Medicaid pricing tied to peer countries, launch prices at parity with what Germany and France and Japan pay, a mechanism to prevent the United States from continuing to subsidize the rest of the world. This is exactly what the president campaigned on, and the president was right to pursue this. The direction is right. The idea is right. The pressure that produced these agreements was real. And the 16 companies that signed on should be held to every single word of what they committed to. But that's exactly the problem. Because what they committed to publicly and what they told their shareholders privately are not the same story. Stat News, a respected health and science publication, reviewed the SEC filings submitted by all 16 companies that reached agreements with the Trump administration. What they found is worth us going through very carefully. Let's start with the duration of the deal. The administration announced these agreements as breakthroughs for American patients, a new era of American drug manufacturing and pricing, a fundamental shift in the relationship between the pharmaceutical industry and American consumers. But when companies were required to disclose the terms to their shareholders in legally binding documents where they cannot misrepresent material fact, a different picture emerged. Merck, one of the largest pharmaceutical companies in the world, their 2025 SEC filing states plainly that they entered into a 3-year agreement with the U.S. government. 3 years. Sanofi, the French pharmaceutical giant, their filing disclosed that their MFN agreement is, quote, in their words, only for a duration of 3 years. Only. Their words. Only 3 years. Now, the White House has said, and this is important to acknowledge, that the 3-year window applies to the tariff relief portion of the deal, not necessarily to the MFN pricing provisions themselves. And that is a legitimate distinction. And it's a distinction that the administration should clarify publicly and completely so that the American people know exactly what was agreed to and for how long. But here's what is not in dispute. The companies themselves characterize these agreements in documents written for investors as 3-year deals. Merck didn't say 3-year tariff exemption with indefinite pricing commitments. They said 3-year agreement. Sanofi didn't say pricing terms that outlast the tariff window. They said only 3 years. When a pharmaceutical company's lawyers write SEC disclosures, they choose every single word carefully. Those words are reviewed by compliance teams and outside counsel. They are designed to accurately represent material risk and commitments to the investment community. And when Sanofi writes only for a duration of 3 years, that is not ambiguity. That is a disclosure. Another pharmaceutical company, while not giving an exact timeline, warned investors something even more telling. They flagged that the administration wants to codify these arrangements into law, which could apply to more products, more payers, and more pricing arrangements for a longer period than those resulting from the MFN terms. I'm going to say that again. Another pharmaceutical company told its shareholders, beware that Congress might try to make this permanent and broader than what we agreed to. Beware that the voluntary deal we signed might not be the ceiling, it might be the floor. This is a company that signed a deal with the President of the United States at the White House and then immediately began hedging against the possibility that anyone might try to hold them to the spirit of it. That is not a partner acting in good faith. That is not somebody you want to invite to your home and ask to sit at your kitchen table. That is a company managing a regulatory risk. So let's talk about who these deals actually cover, because that is a second gap between the public announcement and the private disclosure. The Trump administration's MFN announcement was framed as a relief for American patients. Not some American patients, American patients. The people who are rationing insulin, the seniors splitting pills, the family choosing between prescriptions and groceries, the full scope of American suffering under a system where drug prices are the highest in the developed world. But when you read what the companies actually committed to, the picture narrows considerably. The pricing provisions in many of these deals apply to Medicaid programs. Medicaid, the government health insurance program for low-income Americans. What about the majority of Americans who get their insurance through their employer or through private plans or through an individual market? The Americans who are arguably feeling the most acute pain from high drug prices because they don't have the negotiating leverage of a government program behind them. Experts who reviewed the terms estimated that the most favored nation pricing provisions, as structured, affect approximately 33% of Americans. A third. 2/3 of this country, the Americans with private insurance who are paying full freight for brand name drugs, are not meaningfully covered by what was announced as a comprehensive solution to American drug pricing. Now, I want to be clear about where responsibility for this gap lies, and it does not lie with President Trump. The president's stated goal, most favored nation pricing for American patients, is not a narrow goal. It is a sweeping one. If that goal had been fully implemented as stated, every American paying for prescription drugs would have felt it. The narrowness of the actual terms is a product of negotiation with companies that have every incentive to limit scope, carve out populations, and protect as much revenue as possible while appearing to cooperate. In other words, President Trump pushed for something real. The companies agreed to something smaller. And then they told their shareholders, not you, not the American public, they told their shareholders exactly how much smaller. That's the handshake. That's the gap. That's the con. And the American people deserve to see it clearly. Now, I want to focus on something specific, something that one company put in writing that I think encapsulates everything wrong with how Big Pharma approaches these negotiations. Sanofi, that French multinational pharmaceutical company I mentioned earlier, one of the 16 that reached a deal with the Trump administration, one of the companies that shook the president's hand, in their SEC filing, Sanofi disclosed the following, and I'm going to read this carefully because the language matters. They wrote, quote, "If we are unable to achieve acceptable pricing terms in a given market that are consistent with our MFN obligations, we may be forced to delay or forego product launches in that market entirely, thereby reducing potential revenues and limiting patient access to our medications and vaccines." It's a long sentence. It's an important sentence. So let's unpack it. Acceptable pricing terms. What does acceptable mean? Acceptable to whom? To Sanofi? To a company whose pricing decisions we have spent 5 episodes documenting? A company whose definition of acceptable has consistently met maximum margins protected by patent thickets and lobbying campaigns and marketing budgets that dwarf research spending? We may be forced to delay or forego product launches in that market entirely. Forced? That word's doing a lot of work in that sentence. Nobody's forcing Sanofi to do anything. Sanofi is disclosing that if pricing reform requirements require them to accept terms they don't like, they're reserving the right to simply not sell their drug in that market. In plain English, if you make us charge less, we're not going to give you the medicine. Think about who Sanofi makes medicines for: diabetes patients, cancer patients, people with rare diseases, people who depend on their products to manage life-threatening conditions. And if Sanofi is telling its shareholders, not its patients, not its doctors, not its partners, its shareholders, that pricing disagreements with the US government might lead to withholding these products from the American market, that's a threat. That's a threat dressed in the language of financial disclosure, filed with the SEC, made while publicly claiming to be a good faith partner in President Trump's drug pricing reform. They shook the man's hand. He shook their hand too. And then they told their shareholders not to worry, because if the terms get too uncomfortable, we just won't participate. That's not a partner. That's a party that signed a deal as if it already figured out how to escape. And it gets more remarkable still, because not all 16 companies that the administration announced as having reached deals have actually finalized those deals. Eli Lilly, in their February 2025 annual filing with the SEC, filed more than a month after the deal was announced, stated plainly, "We are currently in the process of negotiating definite agreements to implement these arrangements." currently in the process. Pfizer filed February 26th. They stated they are now in the process of entering into the binding final agreements to implement these arrangements. Now in the process. Think about the sequence of events here. The President of the United States announces that 16 pharmaceutical companies have reached most favored nation agreements. The announcement is made publicly. It is covered as a done deal. The American people are told that a historic shift in drug pricing has been achieved. And at least 2 of the 16 companies named in that announcement file legal documents with the SEC, documents that are required to be accurate, acknowledging that they have not yet entered into binding final agreements. The deal is announced. The handshake was public. The headlines ran. And the companies are still negotiating. Now, I'm not suggesting that President Trump was misled intentionally by his own team. Presidential announcements on complex regulatory matters often move ahead of fully executed documentation. That's normal. It happens. What I am saying is that the companies knew the agreements weren't final. They knew that when the cameras were rolling and the announcement was being made, and they didn't say a word. They let the announcement stand. They let the American people, they let you, they let your family believe the deal was done, and then they told their shareholders the truth privately, through public disclosure that nobody reads except their industry. That's a pattern. It's public posturing, private disclosure. That's the gap. And that is the gap where the American patient lives. I'm going to be extremely honest and direct about something. This episode is not an argument against President Trump's drug pricing agenda. It's an argument for taking it further. We've been advocating for most favored nation pricing for years. President Trump came into his second term with more leverage over the pharmaceutical industry than any president in modern history. The threat of tariffs was real. The political will was genuine. The American people were and are with him on this issue overwhelmingly across party lines. Drug pricing is one of the rare issues where there's no meaningful partisan divide among ordinary Americans. They all pay the prices. They all feel the pain. The president used that leverage. He pushed. He used the art of the deal, and he got 16 companies to the table. He extracted commitments that no previous administration had ever been able to extract. That is real, that is significant, and it should not be minimized, and all the credit should be given to him. But the SEC filings tell us something important about the nature of what was extracted. The companies came to the table and they agreed to the terms, and then their legal teams immediately began the process of limiting those terms in ways that protect as much revenue as possible. 3-year windows, Medicaid-only scope, reservation of the right to withhold drugs, ongoing negotiation of deals announced as complete. This is what Big Pharma does. This is what they have always done. They are extraordinarily good at it. They have spent decades and billions of dollars perfecting the art of appearing to cooperate while structuring every agreement to minimize actual compliance and place the burden on the back of the American consumer. The answer to that is not to accept what they offered and call it a victory. The answer is exactly what pharmaceutical companies are warning their shareholders about: codification. Congress must take what the president negotiated and write it into law. Not as a 3-year deal, not as a Medicaid-only provision, but as a permanent, enforceable, comprehensive statutory requirement that American patients pay no more than the most favored nation price for prescription drugs. Full stop. Voluntary agreements with an industry that has demonstrated in its own SEC filings that it views those agreements as temporary and limited and escapable are not enough. They are not the end of this argument. They are not the end of the deal. They are the starting point. They are the proof of concept. They are the opening chess move in a game that needs to go the distance. The president started something real, and now it is time for Congress to finish it. And if Congress won't, if the pharmaceutical lobby's investment in campaign contributions and K Street relationships is sufficient to keep codification bottled up in committee, then the American people need to know exactly who made that choice and why. There's one more detail from the SEC filings that I want to make sure doesn't get lost through the chaos, because it reveals just how carefully these companies think about the long game. The administration has proposed separately from the voluntary MFN agreements mandatory demonstration programs that would test MFN nation pricing in Medicare Part D and Part B, the programs that cover prescription drug costs for American seniors. Those demonstration programs would be mandatory, not voluntary. Companies could not opt out, and they would run for 5 years. Here's where Sanofi gets very specific in their SEC filing. Sanofi noted that their voluntary MFN deals last 3 years. The Medicare demonstration programs would last 5, and Sanofi pointed out in plain language the timing mismatch between those two windows. Why does this matter? Because companies that struck 3-year voluntary agreements are also flagging that the mandatory Medicare programs, which they cannot negotiate their way out of and which last longer, represent a separate and distinct risk to their bottom line. In other words, the companies accepted 3-year voluntary deals in part because they knew those deals would expire before the longer mandatory programs were resolved. They accepted the shorter commitment while their lawyers and lobbyists work to limit, delay, litigate, or kill the longer mandatory programs. 3 years of appearing cooperative, 5 years of fighting the mandatory rules in court. That is strategy. A sophisticated, well-resourced, long-term strategy designed to outlast political will and regulatory momentum. And it is being executed right now, in public, with one face. In SEC filings, in courtrooms, and lobbying offices with another. So what does the right response to all of this look like? First, the Trump administration should release the complete text of all 16 agreements, every term, every carve-out, every exception, every duration clause, every sentence, every comma, every period. The American people are being asked to believe these deals represent meaningful relief. They deserve to see the actual language and judge for themselves. Transparency is not a concession to critics. It is a demonstration of confidence in what was negotiated. Second, Congress should move immediately on codification, not as a partisan exercise, as a fulfillment of what the president set in motion. The voluntary agreements are proof that the industry will move when pressure is applied. Congress should convert that movement into law, permanent, comprehensive, and enforceable law that does not expire in 3 years and does not exempt 2/3 of Americans because they hold private insurance. Third, the Sanofi clause, the reservation of the right to withhold drugs from markets where pricing terms are unacceptable, should be called out explicitly and legislated against. A company that has benefited from American taxpayer funding of basic research and that has used American patent law to build market exclusivity, that sells into the largest healthcare market in the world, does not have the moral authority to threaten to withhold medicine from American patients as a negotiating tactic. Congress should make clear that any company that delays or forgoes a U.S. drug launch for pricing reasons will face consequences, including accelerated generic competition, loss of patent extensions, and exclusion from government purchasing programs. Fourth, the SEC filings themselves should be treated as evidence, not just by journalists, not just by podcast hosts like me, but by policymakers. What companies disclose to their shareholders in legally binding documents is the most honest statement of their actual intentions. Merck saying the 3-year agreement, Sanofi saying only 3 years, Lilly and Pfizer acknowledging that binding agreements have not yet been finalized. These are not leaks or whistleblower accounts. These are the company's own words, under legal obligation to be accurate. If those words contradict what was presented to the American public at the time of the announcement, if those words contradict what was promised to President Trump, that is not a minor discrepancy. That is a material gap between the deal the public was sold and the deal the companies actually signed. And the people responsible for that gap are not in the White House. They are in the boardrooms and the legal departments of 16 pharmaceutical companies that have spent decades perfecting the art of the agreeable handshake and the fine print exit. What President Trump did, applying real pressure to an industry that had never been seriously pressured before, getting 16 of the most powerful companies in the world to the table, extracting public commitments on pricing that no administration had managed to extract. That matters. It is real. It is the right direction, and it should be recognized as such. But good faith on one side of the negotiation table is not enough when the other side is not negotiating in good faith. And the SEC filings are not ambiguous about which side Big Pharma is on. 3 years announced as historic reform, Medicaid-only coverage announced as relief for all Americans, ongoing negotiations announced as completed agreements, and buried in the fine print, one company quietly reserves the right to simply withhold medicine from Americans if the price isn't what they want it to be. The president set something in motion that the American people want, the American people need, and the American people are crying out for. The industry is already working on their exit strategy. The way you stop them from reaching it is simple. You do what they've warned their shareholders about. You codify it. You write it into law. You take the handshake and you turn it into a statute that doesn't expire in 3 years. It doesn't bend to lobbying campaigns, and it can't be changed by fine print. The president started this fight, and it's now time for Congress to finish it. And in the meantime, every American filling a prescription, every senior rationing medication, every family choosing between a copay and a grocery bill deserves to know what's in the fine print. And that means they need to pick up the phone and they need to call their member of Congress. They need to call their senator and say, codify most favored nation pricing now. And because of this show, we'll share what's in the fine print with them. We'll give them the tools to make that phone call, and we'll make sure we continue to hold Big Pharma accountable. This is Bust Big Pharma. I'm Rob Burgess. We'll be back next week.